So if you've been struggling for insomnia for a while now, you probably have heard of sleep restriction therapy and probably had a heart attack about the idea of restricting your sleep even more when you already don't get a lot of sleep. But what if I told you that engaging in sleep restriction therapy does not necessarily reduce how much time you spend sleeping, and down the line can actually lead to even more sleep than you're having right now? Hi, if you're new here, my name is Dr. Parky. I'm a behavioral sleep medicine specialist. I did my postdoctoral fellowship at the Stanford Sleep Health and Insomnia program, and I'm also the author of the Insomnia Paradox, which is a self-help book providing information about how we can use CBT for treatment of chronic insomnia. So fundamentally, sleep restriction therapy is a bit of a misnomer. It's a poorly named treatment because the goal of sleep restriction therapy isn't actually to reduce how much sleep you're getting. Rather, a better term is something called time in bed restriction. We're simply bringing how much time we're spending in bed a little bit closer to how much sleep you're actually producing, at least right now. So the point of time in bed restriction is to improve the quality of sleep without sacrificing quantity. And typically, if there is a slight reduction in total sleep time, it's usually just in the first week or so when your sleep systems are getting re-regulated, but then afterwards it immediately bounces back to where you were, and over time will actually allow you to increase how much sleep duration you're getting, because the point of sleep restriction therapy is actually going to be able to reduce your overall sort of anxiety about sleep as you're kind of noticing, oh, like I'm actually going to bed, falling asleep pretty quickly, and the quality of sleep is starting to get better. I feel more and more confident about the nighttime. And as you're feeling more confident, your anxiety is going to reduce. And what's going to happen as your anxiety reduces is that your sleep need is going to more and more express itself because it's not being covered by all the anxiety noises that are happening at night. So after the initial restriction, where let's say you were sleeping 6 hours but spending 9 hours in bed, and you brought how much time you were spending in bed down to 6.5 hours, after your sleep systems re-regulate, you're starting to spend most of the time, that 6.5 hours actually sleeping, then there's going to be something called extension. So we're trying to figure out how much sleep your body actually needs. So instead of 6.5, we're going to go to 6 hours and 45 minutes, then 7 hours as your body fills up more and more. And then at some point, your body's like, actually, I feel pretty good now. Like I don't anymore. I'm starting to have difficulty falling asleep. So this is like the golden sort of Goldilocks zone for me. So all in all, sleep restriction therapy is poorly named. It should be time in bed restriction, and it's really just restricting your overall time spent in bed relative to how much you're sleeping to, first of all, improve quality, get rid of those unnecessary awakenings, and then slowly elongate, known as time in bed extension, until the point where you have nice consolidated high quality sleep as well as the right sleep need, the right sleep fit for you. Thanks so much for watching. I'm wishing you some better nights ahead. Take good care for now. Bye-bye.